Confidentiality and privacy in healthcare ethics. Introduction. In healthcare ethics, few principles are as universally recognized and yet as frequently tested as confidentiality and privacy. Confidentiality is the professional duty to keep patient information private. Privacy is the patient's right to control access to their personal information and body. Without confidentiality, trust collapses. Without privacy, dignity erodes. And without both, the very foundation of the patient-provider relationship crumbles. Today we'll explore what confidentiality and privacy mean in healthcare ethics, why they matter so deeply, when they can and cannot be broken, and how they are challenged in our increasingly interconnected digital healthcare world. 1. Why confidentiality matters. Confidentiality is not just a legal obligation, it is an ethical commitment rooted in respect for persons. Patients share their most personal details, sometimes things they've never told anyone else, with the expectation that those details will not be spread beyond the people directly involved in their care. This trust allows for open communication. When patients believe their secrets are safe, they're more likely to be honest, which leads to better diagnosis and treatment. Example: a teenager might not tell a doctor about sexual activity if they fear the information will reach their parents. But without that information, the doctor cannot provide appropriate sexual health advice or screening. 2. Privacy versus confidentiality. These terms are related but distinct. Privacy is the patient's right to control personal information and physical access to themselves. This includes having a private space for medical examinations and choosing who may be present during treatment. Confidentiality is the provider's duty to protect information shared in the course of care. This includes medical records, test results, and personal conversations. You can think of privacy as the patient's claim and confidentiality as the provider's promise. 3. The ethical foundations of confidentiality. The duty of confidentiality rests on several ethical pillars. Respect for autonomy. Patients have a right to decide who knows their personal information. Beneficence. Protecting confidentiality promotes patient welfare by fostering trust. Non-maleficence. Breaching confidentiality can cause harm, emotional, social, even financial. Fidelity. Keeping patient information private honors the trust they have placed in you. 4. Historical and legal context. The commitment to confidentiality dates back to the Hippocratic Oath. Whatever I see or hear, which ought not to be spoken of abroad, I will not divulge, as reckoning that all such should be kept secret. In modern healthcare, this duty is reinforced by professional codes and legal frameworks, HIPAA in the United States, GDPR in the European Union Privacy Act in countries like New Zealand and Australia. These laws don't replace ethical obligations, they reinforce them. 5. Situations where confidentiality may be broken. Although confidentiality is vital, it is not absolute. There are ethically and often legally justifiable exceptions. A. Risk of serious harm to others. If a patient reveals intent to harm another person, confidentiality can be breached to protect potential victims. Example: the Tarasov case in the US, where a therapist failed to warn a woman about a patient's threat, leading to her death. B. Risk of serious harm to self. If a patient is suicidal and in immediate danger, confidentiality may be breached to involve family or emergency services. C. Mandatory reporting laws. Healthcare professionals are required to report suspected child abuse, elder abuse, certain communicable diseases, and gunshot wounds. D. Court orders. A legal mandate may require disclosure of patient information. 6. Balancing confidentiality with public safety. Breaking confidentiality should never be casual. It requires balancing two ethical imperatives: protecting patient trust and privacy, preventing harm to others or the public discussion prompt. If a patient confides that they have active tuberculosis but refuse to stop working in a crowded public space, is breaking confidentiality justified? Why or why not? 7. Confidentiality and technology. The digital age has transformed how patient information is stored and shared. Electronic health records, EHRs, telemedicine, and mobile health apps make healthcare more efficient, but also create new privacy risks. Risks include unauthorized access to digital records, accidental disclosure via unsecured emails or texts. Data breaches from hacking. Ethical practice now demands digital literacy, not just medical knowledge. Protecting confidentiality means understanding and managing these technological risks. 8. Privacy in the clinical setting. Privacy is not only about information, it's also about physical and emotional space. Examples: providing a curtain or closed door during exams, not discussing patient details in public hallways or elevators, asking permission before involving students or observers in care. Even subtle lapses, like making a casual joke about a patient in the hallway, can damage dignity and trust. 9. Confidentiality across cultures. Cultural norms influence how privacy is understood. In some cultures, family members expect to be fully informed about a patient's condition and may even make decisions on the patient's behalf. In others, privacy is intensely personal, and even close relatives may not be told details without explicit consent. Healthcare professionals must balance cultural sensitivity with the patient's own wishes. Discussion prompt: if an adult patient from a family-centered culture wants to keep a diagnosis secret from their family, but the family insists on being told, whose wishes should prevail? 10. Special populations and confidentiality. Some groups face particular confidentiality challenges. Adolescence. Confidentiality encourages honest conversations about sexual health, substance use, and mental health, but laws vary on parental access to records. Patients with diminished capacity. When a patient cannot make informed decisions, confidentiality questions involve guardians or legal representatives. Public figures, celebrities, or politicians may face greater risk of privacy violations due to media interest. 11. Consequences of breaching confidentiality. Breaking confidentiality without justification can have serious consequences: loss of patient trust, damage to professional reputation, legal penalties and fines, emotional harm to the patient, including stigma or discrimination. 12. Strategies for protecting confidentiality and privacy limit access to patient information to those directly involved in care. Use secure communication channels for sensitive information. Educate staff about privacy policies and cultural considerations. Have clear protocols for exceptions and mandatory reporting. Regularly review and update privacy practices in light of new technology. 13. Case scenarios for discussion. Scenario 1. A patient discloses illegal drug use during an appointment. Do you have a duty to report it? Scenario 2. You overhear two nurses discussing a patient's case loudly in a cafe near the hospital. Is this a breach of confidentiality? Scenario 3. A teenager requests birth control but does not want their parents to know. How do you handle it? Closing reflection. Confidentiality and privacy are not optional extras in healthcare. They are the heart of the therapeutic relationship. They affirm the dignity of the patient, foster trust, and safeguard the integrity of the profession. Every time we protect a patient's information, every time we guard their privacy, we say, you matter. Your dignity matters. Your trust matters. And that, at its core, is the essence of ethical healthcare.